A 5-year-old Labrador presents with acute vomiting and lethargy after eating chocolate. What is the most appropriate initial treatment? A. Administer activated charcoal and monitor. B. Induce emesis if within 2 hours of ingestion. C. Provide 4 fluids and supportive care. D. Perform immediate gastric lavage. Answer, B. Chocolate contains theobromine, which is toxic. Inducing vomiting within 2 hours is standard to prevent absorption, followed by supportive care. A dairy cow presents with sudden decreased milk production, anorexia, and a hard, distended left flank. What is the most likely condition? A. Left displaced abomasum. B. Mastitis. C. Ketosis. D. Hypocalcemia. Answer, A. Left displaced abomasum commonly presents postpartum with decreased milk yield and left-sided abdominal distension. A cat presents with severe dyspnea, open-mouth breathing, and wheezing. Auscultation reveals crackles in the lungs. What is the likely diagnosis? A. Asthma. B. Pneumothorax. C. Pulmonary edema. D. Heartworm disease. Answer, C. Crackles with dyspnea and open-mouth breathing suggest fluid accumulation in lungs. Pulmonary edema may result from heart failure or toxin exposure. A 2-year-old ferret presents with lethargy, hypoglycemia, and hind limb weakness. Which is the most likely underlying cause? A. Insulinoma. B. Adrenal disease. C. Lymphoma. D. Hypothyroidism. Answer, A. Ferret insulinomas cause excess insulin, leading to hypoglycemia, weakness, and lethargy, common in middle-aged ferrets. A horse has sudden onset of colic, tachycardia, and pale mucous membranes. Which is the most urgent next step? A. Administer analgesics and monitor. B. Evaluate for surgical colic and contact veterinarian. C. Provide free water. D. Walk the horse for 30 minutes. Answer, B. Acute, severe colic with tachycardia and pale mucous membrane suggests a possible surgical emergency. Prompt veterinary assessment is critical. A dog presents with pruritus, erythema, and secondary bacterial infections. Skin cytology reveals cocci. Which is the most appropriate therapy? A. Oral corticosteroids only. B. Topical antifungal therapy. C. Antibiotics guided by cytology plus addressing underlying cause. D. Frequent bathing with water alone. Answer, C. Secondary bacterial infection requires targeted antibiotics. Treating underlying cause, allergy, ectoparasites, prevents recurrence. A sheep has wool loss and intense pruritus, with small red papules visible on the skin. What is the likely cause? A. Psoroptes infestation. B. Dermatophytosis. C. Nutritional deficiency. D. Lice infestation. Answer, A. Psoroptes mites cause severe pruritus, wool loss, and visible papules. Proper identification allows effective treatment with acaricides. A dog is suspected of ethylene glycol ingestion. Which laboratory finding is most indicative? A. Hyperkalemia. B. Metabolic acidosis with elevated anion gap. C. Hypoglycemia. D. Neutropenia. Answer, B. Ethylene glycol toxicity causes renal failure and metabolic acidosis. Elevated anion gap is a key diagnostic clue. A cat presents with polyuria, polydipsia, and weight loss. Blood glucose is 450 mg per deciliter. What is the most likely diagnosis? A. Hyperthyroidism. B. Cushing's disease. C. Chronic kidney disease. D. Diabetes mellitus. Answer, D. Hyperglycemia with PU/PD and weight loss indicates diabetes mellitus. Insulin therapy and dietary management are necessary. A 3-month-old puppy is lethargic, with diarrhea and vomiting. Parvovirus antigen test is positive. What is the most critical intervention? A. Administer antibiotics only. B. Aggressive 4-fluid therapy and supportive care. C. Isolate without treatment. D. Oral deworming. Answer, B. Parvovirus causes severe dehydration, aggressive 4 fluids, supportive care, and monitoring are life-saving. A cow presents with drooling, difficulty swallowing, and a high fever. Which is the most likely diagnosis? A. Bovine herpesvirus stomatitis. B. Listeriosis. C. Actinobacillosis. D. Rabies. Answer, D. Rabies in livestock presents with neurological signs, hypersalivation, dysphagia, and fever. Extreme caution is required to prevent zoonotic transmission. A horse presents with shifting leg lameness, swelling, and heat in one limb. Which diagnostic test is most useful? A. Radiography. B. Complete blood count. C. Synovial fluid analysis. D. Urinalysis. Answer, C. Synovial fluid analysis identifies joint inflammation or infection, confirming causes of lameness. A dog presents with sudden blindness, dilated pupils, and retinal hemorrhage. Blood pressure is 220/130 mmHg. What is the likely cause? A. Glaucoma. B. Hypertensive retinopathy. C. Retinal detachment from trauma. D. Hypotension. Answer, B. Severe systemic hypertension can cause retinal hemorrhages and acute blindness. Treating the underlying cause is essential. A young calf presents with bloat, dyspnea, and frothy mouth discharge. What is the most appropriate immediate action? A. Administer oral antibiotics. B. Provide 4 fluids. C. Withhold food and water. D. Pass a stomach tube to relieve gas. Answer, D. Frothy bloat requires rapid decompression with a stomach tube to prevent respiratory compromise and death. A dog presents with acute vomiting and melena after ingesting a foreign object. Which is the most critical first step? A. Induce emesis. B. Radiograph to locate foreign body and assess obstruction. C. Administer antacids. D. Wait and observe. Answer, B. Radiographs identify location and type of obstruction. Emesis may worsen obstruction in sharp objects. A cat presents with sudden hind limb paralysis and absent femoral pulses. What is the most likely condition? A. Saddle thrombus. B. Intervertebral disc disease. C. Hip dysplasia. D. Feline leukemia. Answer, A. Saddle thrombus is common in cats with cardiomyopathy. Rapid recognition and supportive care are critical. A dog presents with polyuria, polydipsia, and excessive hair shedding. Blood work reveals elevated ALT, ALP, and bile acids. What is the likely diagnosis? A. Cushing's disease. B. Hypothyroidism. C. Liver failure. D. Diabetes mellitus. Answer, A. Hyperadrenocorticism causes PU/PD, alopecia, and elevated liver enzymes. Diagnostic testing confirms disease. A rabbit presents with anorexia, teeth grinding, and drooling. Which is the most appropriate action? A. Offer soft food and monitor at home. B. Examine teeth and treat dental disease urgently. C. Administer antibiotics only. D. Ignore as rabbits often skip meals. Answer, B. Rabbits can develop rapid hepatic and gastrointestinal complications. Dental issues require urgent attention. A cat presents with vomiting, lethargy, and icterus. Lab work shows elevated bilirubin and ALT. Which condition is most likely? A. hepatic lipidosis. B. Pancreatitis. C. Feline lower urinary tract disease. D. Hyperthyroidism. Answer, A. Hepatic lipidosis presents with anorexia, lethargy, and elevated liver enzymes. Early nutritional support is crucial. A horse presents with fever, nasal discharge, and swollen lymph nodes. What is the most likely infectious cause? A. Strangles, Streptococcus equi. B. Equine influenza. C. Rhinopneumonitis. D. Salmonellosis. Answer, A. Strangles causes fever, lymphadenopathy, and purulent nasal discharge. Isolation is important to prevent outbreak. A dog presents with acute onset ataxia, tremors, and hyperthermia. The owner reports recent exposure to an insecticide. What is the likely cause? A. Heat stroke. B. Organophosphate poisoning. C. Epilepsy. D. Vestibular disease. Answer, B. Organophosphate toxicity causes neurological signs and requires rapid decontamination and supportive care. A cat presents with severe weight loss, vomiting, and large palpable kidneys. Which condition is most likely? A. Chronic kidney disease. B. Diabetes mellitus. C. Hyperthyroidism. D. Feline infectious peritonitis. Answer, A. Enlarged kidneys with chronic signs suggest renal pathology. Supportive care and diagnostics are essential. A horse presents with sudden severe colic and hypovolemic shock. Which fluid therapy is most appropriate? A. Oral electrolytes. B. 4-isotonic crystalloids rapidly. C. Subcutaneous fluids. D. For hypertonic saline only. Answer, B. Shocked horses require rapid isotonic crystalloid resuscitation to restore perfusion. A dog presents with severe anemia and icterus. Lab results reveal positive Coombs test. Which condition is most likely? A. Immune-mediated hemolytic anemia. B. Iron deficiency. C. Hemorrhage. D. Bone marrow suppression. Answer, A. IMHA causes hemolysis, anemia, and positive Coombs test. Immunosuppressive therapy is indicated. A 3-month-old puppy presents with nasal discharge, conjunctivitis, and coughing. Vaccination status is unknown. Which is most likely? A. Canine distemper virus. B. Parvovirus. C. Rabies. D. Lyme disease. Answer, A. Distemper causes respiratory and ocular signs in unvaccinated puppies. Supportive care is critical. A cat presents with hypothermia, bradycardia, and lethargy after ingesting rat poison. Which type of toxin is most likely? A. Anticoagulant rodenticide. B. Cholecalciferol rodenticide. C. Bromethylene rodenticide. D. Metaldehyde. Answer, C. Bromethylene causes neurological signs including hypothermia, lethargy, and bradycardia. Rapid intervention is essential. A dog presents with sudden collapse after swimming in a lake. Which pathogen should be suspected? A. Leptospira. B. Rabies virus. C. Parvovirus. D. Canine influenza. Answer, A. Leptospirosis can cause acute renal failure and collapse after exposure to contaminated water. Treatment requires antibiotics and supportive care. A rabbit presents with dyspnea, cyanotic mucous membranes, and rattling in lungs. Which condition is most likely? A. Pasteurellosis. B. GI stasis. C. Ear mite infestation. D. Dental disease. Answer, A. Pasteurella infection can cause severe respiratory signs. Prompt antibiotic therapy is needed. A dog presents with sudden onset hematuria and straining to urinate. Which is the most urgent diagnostic step? A. Abdominal palpation only. B. Urinalysis and ultrasound to check for obstruction. C. Wait and observe. D. Administer analgesics only. Answer, B. Urinary obstruction is life-threatening. Timely diagnostics prevent renal damage. A horse presents with lameness and firm swelling over the cannon bone after a race. What is the likely condition? A. Bucked shins, periostitis. B. Fracture. C. Tendon rupture. D. Navicular disease. Answer, A. Young racehorses commonly develop periosteal inflammation. Bucked shins, rest and management are essential.